Our next section is all about prosocial behavior. Now, prosocial behavior is just a fancy way of saying helping behavior. So we're going to be talking about acts of helping others. And again, earlier in the textbook, back in chapter 4, which you would have covered back in 104, there are evolutionary approaches to prosocial behavior. So they would have talked about altruism and two different evolutionary theories that would talk about how altruism might have evolved. Looking at kin selection, where we are most likely to help others that we share more genes with. So you're a lot more likely to help a sibling or a child than you are to help, say, your fourth or fifth cousin or someone who's not related at all. So that helps explain why behavior like altruism, where you put yourself at risk with no real benefit to yourself, is the kind of behavior that might evolve. Because usually behaviors that put you at risk are evolved against. They wouldn't become more common in the population because if you put yourself more at risk, you're more likely to die. So kin selection was one of the ways that evolutionary theorists have proposed to try and explain away the problem of altruism. Another way of looking at it is using the theory of reciprocal altruism, basically saying that you help someone so that they help you in return at some point in the future. And for this one, you see evidence with humans and other species where if you give assistance to someone, they're a lot more likely to help you out in the future. It kind of relates back to stuff we talked about earlier in the chapter where you can get your foot in the door by helping someone early on and they'll reciprocate in the future. So these are two ways of explaining, evolutionarily speaking, how altruistic behavior or helping behavior that can put yourself at risk or reduce your survival might have evolved despite the surface interpretation where behavior that puts you at risk shouldn't be selected for. But of course, because it's already been covered earlier in the book and by a different course, we're going to focus more on the social side of things, on the psychology side of things, and less on the evolution. It's just important to know that it exists. So if we talk about social learning and cultural influences, we can talk about the norm of reciprocity. And this is kind of related to this reciprocal altruism, but it's basically focusing on the social side of things where you are a lot more likely to help others who have helped you. So you are going to reciprocate because you've seen someone who's willing to help you, so you're more likely to help them. Now, this isn't specific to just things like altruism. This is also things like if somebody treats you nicely, you should treat them nicely in return. So if someone helps you, you help them. If someone is kind, you should be kind back. So that's the norm of reciprocity, where it's a social norm that you should respond in like fashion. We also have a norm of social responsibility. And this is sort of a bigger than just yourself idea, where you should help others and try and contribute to society's welfare. So society expects that you should overall try and be helpful and contribute to society as a whole. Now, with most norms, as we've already discussed, you're going to have support and reinforced good feelings where people will be happy when you follow these norms. And if you don't follow these norms, it's going against social norms. It's something that would be punished or disapproved of. So it feels weird to be rude to someone who's being kind to you. And people will look down on you if you won't do something to help your community. If you see someone littering and that's directly going against that community's well-being, then you're going to think poorly of that person. So they're going against the norm of taking responsibility for their environment. Now, these norms have to develop from somewhere. So as you grow up and you see other people acting in these ways, you start adopting those norms yourself. We can see these norms evolving through socialization. So children will act more pro-socially if they're taught empathy. So if children learn to put themselves in others' shoes or to think about what it must feel like to be that person, they're a lot more likely to help because they can empathize with those who are in that situation. And as you might imagine, there are quite a few cultural influences on helping behavior. So a study that was done on people in India, specifically people who were Hindu, they feel that it's a moral obligation to help people around them, regardless of the size of their need. So they would be just as likely to help someone find a lost pencil as they would be to help someone try and raise money to keep their house. So whether it's a large or a small problem that they're being faced with, you are morally obligated to help those people. Whereas a study conducted in America showed that for situations where the assistance required is mild, where there isn't a big need for help, that individuals should feel less obligated, and that it's your choice if you offer to help, but you don't have to feel like you need to. So cultural differences tell us what the norm is for responding to helping those that you interact with. Now, I've kind of already given us some groundwork to talk about the next section, which is getting into empathy and altruism. And so, like I said, altruism is that idea of doing something selflessly, doing something that isn't going to directly benefit you, but ends up being a good thing for others. Now, when we talked about it in terms of evolutionary theories, we're talking about altruism as in putting yourself at physical risk, but altruism could also just be something like, I give money to someone and expect nothing in return. Now, there's lots of debate as to what's motivating this kind of behavior. There's a lot of people who believe that altruism isn't a real thing, that people are somehow getting some benefit from all acts, and no one is truly altruistic. But that's a pretty big can of worms to open up, because that is a very strong, ongoing debate. But we're going to talk about one theory that's the empathy altruism hypothesis. And so, like we've already said, empathy is that ability to share another's experience, that ability to put yourself in someone else's shoes. And this hypothesis states that we exhibit altruism because we can empathize with those who are in need. So we can put ourselves in the shoes of someone who's struggling, and we decide to help them because we can feel what they would be feeling. We can sort of put ourselves in their shoes and understand what it is that they need and what it must be to be them. So our altruism stems from being able to relate to the people that we're helping. Again, there have been tons and tons of studies done looking into this hypothesis. And so the theory for the main one that's talked about in the textbook is that it's easier to empathize with someone who is more similar to you. So you could set up a situation where you can pair people with individuals who they are more or less similar to, someone it is easier or harder for them to empathize with, and see how much altruism they show based on that degree of relatedness, that degree of ability to empathize with them. The specific experiment from the textbook set up a participant and a confederate who were paired together, and they had differing degrees of relatedness, and through a rigged coin flip, the confederate would be assigned to be the one of the pair who would be receiving electrical shocks as part of this particular task. And the person who was supposed to be receiving these electrical shocks would express fear and discomfort and not wanting to do that. And the test was to see whether the participant would volunteer to take the confederate's place. And the more that they were similar to each other, the more that the participant could empathize with the confederate, the more likely they were to offer to take their place, the more likely they were to exhibit that altruistic behavior. We can also see these increases in altruistic behavior for things like charitable donations or just relating to others and choosing to help. But there's another angle to consider here. And that's, maybe it isn't that feeling of empathy and the desire to help. but maybe it's the fact that they would have felt guilty if they hadn't helped. Or maybe it's like the negative state relief model says, and this high feeling of empathy actually leads people to feel distress when they're seeing others suffer. So it's not that they can put themselves in the other's shoes and they want to help. It's maybe that seeing other people suffering causes them distress, and by acting in a theoretically altruistic fashion, by helping or exhibiting that helping behavior, they're really just reducing their own personal feelings of distress. That act of helping is really just motivated by trying to reduce their own feeling of awfulness, that own negative state. They're trying to relieve it. Now, we can't really talk about helping behavior without talking about the bystander effect and getting into sort of when people decide to help and what might happen to inhibit our response. So we can look at this 5-step model that the textbook outlines. And this is basically deciding if a bystander, if someone who has come across a situation decides to intervene. So what has to happen is that at each step here, the person has to say yes, or they have to come to a positive answer to the question. So the first thing that has to happen is, do you notice the event? If you don't notice the event happening, you can't make a conscious decision to help. So if you say no right off the bat, automatically no help is given. But if you say yes, I've noticed the event. Okay, do you interpret that specific event as an emergency? Is this something that you should be intervening in? If you answer yes, then we keep going. No help is given. So continuing on, then we have to decide, do you assume responsibility for helping? Is this something that you should do? Should I go and help this person? If yes, do you know how to help? Is this something that you would be capable of helping with? Sometimes the situation requires the kind of assistance you're not capable of giving, so you might say no at that step. Then the last step is that you actually have to decide to help. So you noticed it, you know it's an emergency, you feel a responsibility to help, you know how to help, but then you have to consciously decide whether or not to get involved. So this is the last, where if you say yes on the final step, then yes, you will help the victim. If not, no help is given. And this kind of leads us to interpreting that bystander effect, where sometimes people should help, but at some point along this list, they choose not to help. So the first one, maybe you don't notice it. That's kind of easy to explain. There's the second one where maybe you don't interpret it as an emergency. This might help explain one of the experiments where participants were sitting in a room with a bunch of other people, and the room slowly started filling with smoke. But other individuals in the room didn't respond to the smoke. So the participants wouldn't interpret it as an emergency because, well, no one else is noticing, no one else is reacting. So maybe that's what happened there. Assuming responsibility for helping, maybe they think, well, it's not my problem. Maybe something's going on, but it's not my place to intervene. Maybe somebody is acting up in the classroom, and that's not your job to tell them to stop being an idiot or stop being a disruption. That's the teacher's job. So you don't say anything. You don't know how to help. Well, maybe somebody needs CPR, but you don't know CPR. So you helping is going to make matters worse. So you shouldn't step in. So at all of these stages, there are things where it can get in the way of people deciding to help. And this next slide, I actually kind of got ahead of myself and talked about a lot of these in advance. So for deciding if it's an emergency, we talked about using that social comparison. So if others aren't reacting like it's an emergency, maybe you don't think it's an emergency either. That responsibility to intervene, we can go a little bit more in depth here though, because it points out that multiple bystanders being present might inhibit your tendency to help. You might think, oh, somebody else must be doing this. Somebody else must be calling the police. Somebody else must be intervening. Therefore, it's not my responsibility. Though people aren't necessarily as completely helpless and quick to throw responsibility to others as a lot of psychological experiments might have you believe. There's lots of anecdotes and stories about cases where people were attacked on the street, and out of the hundreds of witnesses, no one ever called the cops. But a lot of those are just that, anecdotes. And the more you dig into them, the more you find out that actually, no, people did call the cops. It's just a better story if you don't focus on that side of things. So another of those to think critically about things that are presented. But there is evidence for this diffusion of responsibility, where if there are other people present, individuals are less likely to step forward themselves. And whether you act or not, your decision to act or to help or not help can depend on your own self-efficacy. How confident are you in dealing with this situation? Is this something that you have been trained to handle and you are confident in handling? Or are you scared to step forward? Are you a lot more comfortable allowing someone else take over? And this leads us into this idea of, well, okay, so if that's how we decide to help, who are we actually going to be helping? So what makes us more likely to help someone out? We tend to help people who are more similar to ourselves, someone who's easier to identify. So if it's someone that you look at and go, oh my gosh, that person is just like me, then you're going to be a little bit more likely to help. So if someone is the same age as you, the same gender, maybe you're going to be more likely to help. You're also more likely to help someone who's not responsible for causing their own misfortune. So you might have to attribute their personal state, whatever's going on. Is that something that they caused, or is it something that just happened to them? So you might be more likely to want to help someone who has fallen on hard times through no fault of their own. But if somebody is in a tough place because they made a really dumb decision, then maybe you're going to be a lot less likely to help them out because you think that they deserve it. Which in turn leads us to this just world hypothesis, where we want to perceive the world as fair and just. And that can lead us to have this underlying assumption that people are getting what they deserve. Bad things happen to bad people, so maybe I shouldn't help because this is happening for a reason. So there's lots of things that can influence our decision to help, especially when we're deciding to help this particular person. And this is another one of those concepts that has a lot more to it than we have time to discuss. But this idea of a just world hypothesis can sort of start explaining things like victim blaming, where people will blame the victim for being in that situation to try and reduce their own feeling of responsibility to help. So people will start justifying, well, I didn't help because that person obviously deserved to be in that situation. So it gets very complicated, and it's, again, very interesting to look at. And we can end with talking about ways of increasing prosocial behavior. How do we encourage people to help? If we expose people to prosocial models, if they see other people exhibiting that same behavior, we can increase their likelihood of themselves being more prosocial. So if you see someone who's donating to a charity, you might look at that and say, oh, I should do that too. So you've seen a model exhibiting that prosocial behavior of donating to a charity, and you emulate that modeled behavior. And this happens for children, where children are a lot more likely to help and sort of do these kind behaviors if they see someone else helping and being kind. So being raised by a parent who is big on, say, promoting empathy and putting yourself in others' shoes and helping others can lead a child to grow up being more likely to help. And that brings us again to encouraging feelings of empathy and connectedness to others. So, the more empathy you have for the person who's in trouble, the more likely you are to help them. This is sort of exactly what you see in commercials looking for donations for charities. They try and make you relate to the individuals on the screen as they're showing you the suffering and the hardship, trying to encourage you to empathize, to feel for them, to feel connected, like you can help this one individual by donating. So it's encouraging that prosocial behavior by playing with empathy and connectedness and the way things are presented. And we can also try and learn about factors that hinder that bystander intervention. So if we know that people tend to lose individuality when they're standing in a group, maybe you learn to single people out so that they don't feel like just part of a group. So you can say, hey, you in the red shirt, call the police. And that makes that one person feel responsible. They should absolutely get involved because they've been singled out. They are responsible now for calling the police. So you can kind of get around some of these inhibitions for prosocial behavior by just understanding what's going on and how to get around it.